price of medicine.
Welcome to Medical Malfunction, and today we're going to talk a little bit about nurse navigators. What the heck is a navigator and what do they do? Well, nurse navigators can come in many forms other than the nurse part. That's sort of an indicator, but you might find a nurse navigator attached to a specific clinic or a specific diagnosis that you have. For instance, on my current journey, they have breast cancer nurse navigators that are attached to the breast clinic that you go to. So since I'm dealing with a breast cancer diagnosis, they'll usually call you and make sure that you're following up on the types of testing you still need to do, any follow-up care you need to get, and stay on top of you for those types of things. Sometimes they can help to move that care along, sometimes they can't, and then you start to wonder, why are you even bothering me? So it can be a little bit frustrating at times too. But that's another story. That's just about our system, because sometimes they can really move things along when you need them to. And so take down their numbers, take their cards, keep the specific clinic nurse navigators handy. Definitely, they can help you when you really get into a jam. It just depends on how the particular care facility that you're going to is set up and how much, I don't want to say power they have, but how empowered they are within that facility. The other type of nurse navigator that you'll find is sometimes attached to your employer, sometimes attached to your insurance plan through your employer, or it's attached to your insurance plan in general. And what they do is, I'm going to start with the one that's attached to your employer and your insurance plan together, because a lot of folks, most people in America, frankly, have their insurance is tied to their job somehow. And I know this might make some folks nervous because they feel like they're sharing PHI, but actually those things are kept very separate. And usually you will have a dedicated nurse navigator that's dedicated to your plan. They know your plan, they know what your benefits are, and they are there to help you move authorizations along. They're there to tell you what's covered and what's not covered in a more efficient way, and they are most knowledgeable about how to get things done according to your plan, according to what you've opted for in your plan, and according to what your company already covers. So those nurse navigators can actually really help you when you're trying to get things approved, when you have questions about what's actually covered, when you don't really know where to go next. Sometimes they have ideas. Hey, I've been to this doctor, I've been to that doctor, or hey, this wasn't approved. Why is that? Should I appeal that? And if you have just really basic questions about that, they can be super knowledgeable. And yeah, they are clinical, of course. So technically, they're probably not going to give you too much advice along those lines. Just like I'm not here to give you clinical advice, but they are there to kind of help you help guide you along the clinical path to get you where you need to go. And sometimes they can help move those approvals along. So don't sleep on the nurse navigators. They're out there and they're a resource that are there for you. And don't worry too much about that crossover, because that line is there for the PHI. They're not there to share information. I know some folks do get nervous about it, but it really is meant to protect your privacy and help you get things done. So just as much privacy as we have these days, this is what it's here for. So anyway, so go out there and get some good medicine and give some good medicine.